The name of this test is the Hoffman sign. To perform this test, I'll gently dorsiflex the patient's foot while their knee is extended. I'm looking for pain in their calf. A positive test would be calf pain during the movement. The associated pathology is thrombophlebitis. Okay. The name of this test is Hoffa's test. To perform this test, I'll compare the tension of the Achilles tendon on both sides. I'm feeling to see if the Achilles tendon is less taut than normal. A positive test would be the Achilles feeling less tight or less firm. And in this test, you're going to have the patient dorsiflex and plantar flex their ankle. The associated pathology is a possible calcaneal fracture. The name of this test is the Thompson test. To perform this test, the patient will be laying face down with their foot hanging off the table. I'll squeeze the calf muscle and watch for movement of the foot. A positive test would be no movement of the foot when the calf is squeezed. The associated pathology is an Achilles tendon rupture. The name of this test is the squeeze test for syndesmotic separation. To perform this test, I will squeeze the tibia and fibula together at the mid-calf area. I'm looking for pain near the ankle syndesmosis. A positive test would be pain over the syndesmosis. The associated pathology is an injury to the anterior talofibular ligament. All right. The name of this test is the Klager test. To perform this test, I'll stabilize the lower leg and rotate the foot outward. I'm watching for pain around the ankle, especially near the syndesmosis or medial ankle. A positive test would be pain during the movement. The associated pathology is a high ankle sprain. Okay, here we go. The name of this test is the Taylor tilt test. To perform this test, I'll stabilize the lower leg and gently tilt the ankle inward and outward. I'm checking for excessive movement or looseness. A positive test would be a noticeable laxity compared to the opposite side. The associated pathology is injury to the calcaneofibular ligament or deltoid ligament. Okay. The name of this test is the anterior drawer test. To perform this test, I'll stabilize the lower leg just above the malleoli, and with one hand I'll hold the heel. With the other hand, I'll gently pull the foot forward to check for excessive movement. The positive test would be increased laxity or loosen compared to the other side. The associated pathology is injury to the anterior talofibular ligament or calcaneofibular ligament. Yeah. So the name of this test is the percussion test, also called the bump or tap test. To perform this test, I'm going to have the foot in a neutral position, and I'll gently tap or bump the bottom of the heel so force travels up through the bones of the lower leg. I'm looking for pain at the suspected fracture site. Positive test would be pain where the fracture may be located. The associated pathology is also a possible fracture. All right. So the name of this test is the Potts compression test. To perform this test, I'm going to gently compress the tibia and fibula together above the ankle. While doing this, I'm going to watch for the patient's response and ask if they feel any pain near the suspected injury area. A positive test would be pain at the fracture site. The associated pathology for this test is a possible fracture.